My name is Keith. I'm a meditation teacher, and these Wednesday live streams are all about introducing meditation to those of you who are new, those of you who want to get into it, those of you who are having trouble sticking with it, those who are experts, whatever. And not just, we always introduce it because a lot of people are new. This is their first time. But then we focus on a specific topic and how meditation can help us in our life with this specific topic. Because meditation is really good for a lot of things. So we're going to kind of spread the love a little bit. I like to reference this stream as sort of like a cookbook, right? A lot of recipes in there. And you got to pick the recipe which kind of calls to you. So if you are new, please ask questions. There's a really great community of people here that, we've developed over the last year. I can't believe it's been going on that long. It's awesome. And if you have any questions about this, just, pop them into the chat. I will literally stop whatever I'm doing and answer, unless I make a mental note that I'll forget what I'm saying, in which case I'll finish my thought and then I'll answer it. But please feel free to ask any questions. That's what this live stream format is good for, right? You can't ask a question to a pre-made video. Well, this isn't a pre-made video. I'm saying these words right now. All right. So with that said, I think let's start by talking a little bit about what meditation is, right? Because for a lot of you, this is your first time. We get a lot of new people each week, which is awesome. And meditation is becoming pretty popular, which is really awesome. So meditation, right, is like, on a whole, if I had to sum it up, it's a technique for familiarizing your mind with something, right? So I've been using the analogy a lot of like running a race, like training, right? And if I were to run a race right now, it wouldn't go so well because I'm not a good runner and I don't train. So if I was like, I want to go run a 5K, I'd probably get a little bit down the block and then I'll turn back and come lay on the couch and I'll be really sore the next day. And I'll be like, this is not a great idea. But if I was determined, right, to run this race, well, I ran maybe 10 minutes each day. I can go a little further, right? The next week I can go a little further. I wouldn't be as sore. My muscles are starting to recover quicker. I'm able to run further and faster. Like, whoa, okay, cool. Guess what's happening? My body is becoming familiar with running, right? And by virtue of that, it's coming more naturally to me, right? The motions of running, the recovery process of running, it's starting to come more naturally, right? My body is not like, whoa, right? So meditation is very similar, right? We're training our mind instead of training our muscles. We're training our mind to become familiar with whatever we want. Being more peaceful, right? Stress is probably the number one reason people get into meditation. Well, meditation isn't just like, it's not like taking Advil or something like that, right? We're training your mind to become familiar with being peaceful so much so that peacefulness comes more naturally to you. Just like running will come more naturally to you if you train, right? Ooh, let me catch up. Ellen, welcome. There's a lot of Pennsylvania here. Cool. Oh my gosh. So that's like kind of an overview of what meditation is doing, right? It's familiarizing your mind. We're basically using it as a learning tool, right? We can familiarize our mind with whatever we want, right? If you like, hey, I get angry easily, right? Well, we can familiarize our mind with patience. So much so that the scales, right now, the anger scale is like up here, patience is down here. We have to try really hard to be patient, and anger seems to come very naturally to us. We can start to tilt the scales in the other direction, right? All by choosing what we want our mind to focus on, right? Now, that's a very important part because right now, we're kind of letting our mind do whatever it wants, right? Our mind is all over the place all day. It's like, hey, now you're going to think about this that happened earlier. And we're like, okay, here I go. And I'm thinking about this. And then it's like, nope, now we're going to worry about the project coming up later. And I'm like, okay, here we go, right? So it doesn't seem like we're in control of what our mind is thinking about. So meditation kind of gives us back this control. It empowers us to choose to say, mind, I know you want to go think about that thing that happened earlier, but right now we're focusing on this. So we're just kind of get on back. So meditation is kind of like a two-step process with these two things that we were just talking about. So first, we have to learn how to relax our mind, because when our mind is super busy, right, it's not really working optimally. Like things that wouldn't normally upset us a great deal. You know, we're stressed about things you normally wouldn't stress about, that kind of thing, right? All when our mind is really like bombarded with stimuli, just like and stress and anxiety, like all these, you know, not nice states of mind, right? So we have to learn how to relax our mind a little bit, and then we want to use that relaxed mind to intentionally focus on something, to intentionally learn about something, to intentionally familiarize our mind with something, right? And my favorite analogy for this is the one, I don't know if you've heard about it. It's a joke because I say it every week. If you are on a hike, right, you come to a nice lake or a pond. I'll change it to pond. Now it's different. And, you know, it's very still. The water is very still. There's no raindrops. There's no breeze. There's nothing. Right? You can see the reflection super clear. It starts to rain a little bit. The wind picks up. Well, now the water's rippling a bit. Can't describe the reflection as clear. Might still be able to describe it, but not as clear as when it was still. Right? And if it really starts to downpour, gusts of wind, you might not be able to see that reflection at all anymore, right? So this is an analogy for our mind. Our mind is normally like a still lake by default, very calm, very peaceful, very reasonable, thinking clearly, right? Clear. That's a good word for it, right? Clear. But all of the anxiety, the stress, the bombardment of things that are going on in our mind all day long, they're kind of like the raindrops, and they're obscuring this peacefulness in our mind. So we got to kind of get that back. And the way that we get that back is by clearing away some of the raindrops, clearing away some of the distractions, the stress and bombardment of thoughts in our mind, right? And the method we use to do this, is called single-pointed concentration, right? Very fancy. Please, Keith, make a meditation to anxious trying to conceive moms. Wow, that's actually a really great idea. Wow, I have to think about that one. That's a really great idea. Definitely a lot of anxiety involved in that. We just did a pretty hefty dual class on anxiety, which you might want to check out, because that definitely falls into that category. That's a great suggestion. All right, brainstorm that one. Okay, so what was I talking about? Single pointed concentration. Yeah. So single pointed concentration is a fancy way of saying you are focusing on one thing, right? You are not multitasking. This is very hard for us. We multitask all the time. Right? Our whole lives are multitasking. Right? But if you've ever had the experience of being in the zone, you know, like maybe you're working at something at work, right? Making a sweet Excel chart or something, right? And what happens? You lose track of time, forget to eat lunch. You know, the person that's normally kind of loud and distracting, it's like they're kind of gone, right, in the office or whatnot, right? All these things that are normally clamoring for our attention, pulling at us, right? It's as if they no longer exist. They start to melt away a little bit, right? All because we are so single-pointedly focused on one thing, right? So we're going to do that intentionally. Well, as that happens unintentionally, but we're going to train our mind to do this intentionally. And the thing we're going to focus on is our breath. Why? Because one great reason is that your breath is always with you. So we're trying to teach you how to use meditation in your daily life. Well, what better thing to have than use your breath, which you literally have everywhere you go, hopefully. So if we get good at using our breath as kind of a focal point to relax us, we start to feel empowered that we can do this wherever, whenever we need to, which is really good. And a really good and really important lesson in meditation, that we don't need like specific external conditions to be able to meditate well. Like, we do not need the perfect quiet. We do not need to be at a serene, nature lake or mountaintop, or we don't need to like leave our friends for a month. No, all we need is just a little patience and our breath, and we can learn how to de-stress a little bit, how to relax our mind a little bit. Does that sound good? I want to do one now. So we're going to do a breathing meditation now. It's like going to be 5 minutes. Right? So you're like, I hope we're not sitting there that long. You won't be. It's only going to be about 5 minutes long, give or take. I do not have a stopwatch, but instructionally, it's pretty simple. We're just going to relax. Right? We're going to focus on our breath, the sensations of our breathing. You're going to follow along with what I'm saying. That's my job to guide it. And whenever you notice that your mind is like, I'm going to go think about this thing, right? Not the breath. You're going to be like, nah, sorry, mind. We're coming on right back to breathing, right? So this concept of focusing on our breath, choosing to focus on our breath, noticing when our mind has drifted, and being able to bring it back, that is meditation. The goal of meditation is not to never become distracted, but rather to be able to notice when you are distracted and skillfully bring your attention back to breathing. That's meditation. Okay? Cool? So if you're sitting down in a chair like me, great. If you're on a cushion on the floor, great. If you're laying down, also great. It doesn't really matter. All right, I just want to be comfortable. That way, we're not focusing on being uncomfortable instead of what we're supposed to be focusing on, which is our breath. All right, so you can go ahead and just sit comfortably. Are we doing the mountain meditation tonight? Oh, I wasn't planning on it. I could do it though. Maybe if there's a consensus that everyone wants to do it, I'll do it, because it would work really well for what we're talking about here. So. I'll think about it. Okay, so sit comfortably, relax, close your eyes, and just follow along with what I'm saying. We're going to do about a 5-minute breathing meditation. The first thing we do whenever we start a meditation is to check in with ourselves. How are you feeling right now? What is your mind up to? Is it happy? Is it sad? Is it tired? Energetic? Alert? Dull? Whatever it is, it does not matter. We are just practicing noticing what our mind is doing. This is called mindfulness. Probably heard that word before. Mindfulness is a moment-to-moment awareness of your thoughts for the purpose of being able to skillfully respond to them. So just check in. How are you feeling? And having checked in, you can now turn your full attention to your breath, in and out of your nose. Very gentle breaths, very natural breaths, in and out. You do not need to take big, deep inhalations or forcefully exhale the air. We're just breathing normally, in and out. Allow yourself to relax into your chair or your cushion. Allow your shoulders to relax. Allow your arms to relax. Allow your whole body to relax as you breathe in and out, very gently, very naturally. And if you notice that your mind has wandered, maybe it's thinking about something that happened earlier today or something coming up later, just gently guide it back whenever you notice that it's drifted. Gently guide your attention back to breathing in and out. Very gently, very naturally. See if you can follow each breath in and out in its entirety. Stay with your entire in-breath and your entire out-breath. What does that feel like? What kind of things do you notice as you're breathing in and out? Keep bringing your attention back to your breath whenever you notice that it has drifted. This process of choosing to focus on your breath, noticing when your attention drifts, and being able to skillfully bring your attention back to breathing is meditation. You are meditating right now. You are training your mind to relax, to be calm, to be happy, to access its default state, which is peacefulness. And you're doing it with nothing other than your breath. How wonderful. How wonderful that you are able to relax your mind even just a little bit by breathing in and out very gently, very naturally. So just continue breathing in and out, focusing on your breath for a little while longer. Okay, when you're ready, you can open your eyes. How'd that go? Whoa, we got a lot of people who want the mountain meditation. It's happening. Okay, we'll do it. It's actually a really good one for chronic pain. So, good suggestion. You guys should write the material. How'd that go? That was a pretty 5 minutes. Maybe it was more. I don't know. It's hard to tell. But that's a pretty standard, like traditional breathing meditation, right? And maybe you were like, wow, that was actually kind of hard. And if that was your experience, well, I don't know, you shouldn't be that surprised, because when's the last time you tried this? Have you ever? When's the last time you're like, I'm going to sit quietly and focus on my breath, and I'm going to notice when my attention has drifted and bring it back? Like, okay, never. So we don't really have a lot of familiarity with doing this, right? That went great. I was really focusing on my breath. Gail, that's great. Well, Gail, you've been coming for a while, so like you're starting to see getting into the groove, right? Oh, Nancy with another vote. Okay, cool. So even if you were like, that was pretty challenging, right? That's kind of normal. to be expected, right? And a lot of times for new meditators, I always like to mention this because I think it's really insightful. Somebody said it to me when I was first starting meditating a long, long time ago. And I remember I was thinking and I said like, oh, I feel like my mind's busier when I meditate, right? And they told me, and now I'm telling you, that that's just you noticing how busy your mind is all day long, right? So the kind of pull to think about different things is happening all day long. Very exhausting to think about that. That's why we're mentally exhausted, right? Our mind is kind of redlining, right? Like it's really the pedals to the floor on our mind all day long, right? So sometimes when we try to be like, nah, chill for a second, mind's like, no, I don't know how. So it's going to take some time to practice, right? It's going to take some time to practice. Cynthia, that was nice. Great. Okay. Randy, went great. You have a smooth jazz voice. Oh, I missed my calling. Oh, no. Okay, so when we're just getting started, right? Key is to kind of be patient with it and to be honest with yourself about what is a good amount of time for you to meditate. I think that's like the most important thing, right? So you do not need to meditate for an hour to see benefits at all. You don't even need to meditate for 5 minutes, right? Whatever you're able to do consistently, whether it's 30 seconds, 2 minutes, whatever, right? That's what you should do. And that's what you should stick to until you feel like empowered that you can do a little more, right? Because consistency is what encourages familiarization. Just like if I was going to run a race, I'm not running once a month. I'm going to run every day, right? Because I want to familiarize my body with these things, right? Okay, good. Any questions on breathing meditation or my smooth jazz voice or anything else before I move on to the billboard topic today, chronic pain? Gail, it's easy to let go and breathe with your guidance because you're trustworthy. Oh, that's very sweet of you. Thank you. Meditation is like something that a lot of times we think is really kind of like out there and like, well, I don't really understand. It's like just pretty simple. You're just choosing to focus on something. It's just like being in the zone, right? So hopefully it's being presented in a way that's like accessible. That's kind of my goal. All right. So chronic pain. This has been a request for quite some time, and I've finally gotten around to working up a little class on it. And it's a really interesting topic for meditation. Especially as I started to think about like chronic pain, I started to see like, wow, chronic pain kind of spans a lot of different like aspects of our life, right? So if we're going to define chronic pain, right, I was thinking like, how am I going to define chronic pain? And I came up with an unpleasant feeling that is persistent. And like, yeah, I was like, oh yeah, I think that makes sense, right? So like, if we have a knee injury, I injured my knee skiing last year, and like, this is how you know you're starting to climb in age. Is I go to the doctor and they're like, I think you're okay. And I'm like, ooh, it hurts a lot. Okay. Glad I'm okay though. And then now as a year later, my knee still hurts. I'm like, I don't feel okay, but I guess it's just my body getting old. But it's like a chronic pain for me, now, right? So that's like a physical chronic pain, right? It doesn't have to be an injury. Sometimes it can be a condition like eczema, like itching, right? I've talked about I have like itching phobia, right? So like itching can be like a chronic pain, right? It's an unpleasant feeling that is persistent, right? And so the more I kind of thought about it, because I was like, well, not everyone might identify with, like having a knee injury. Congratulations if you don't. The more I was thinking about it, I was like, hey, you know what? Like anxiety is kind of a chronic pain, right? It's an unpleasant feeling that is persistent, right? Depression, an unpleasant feeling that is persistent. Loneliness, an unpleasant feeling that is persistent, right? So chronic pain doesn't have to just be physical. It can be mental too, right? Laura, chronic pain impacts mind and body too. Yes, exactly. Right? So even if you're like, hey, I don't have a knee injury, my shoulder feels great. Awesome. But like maybe there's some like mental chronic pain that you're going through, right? And so today we're going to kind of talk about a couple methods that we can use meditation for, meditation and mindfulness to help manage it a little bit, right? Because one of the interesting things about chronic pain, both like physical and something like anxiety or depression, is we don't really realize how big of a role our mind plays in these things. Now, that's not to say that like your knee actually isn't injured. My knee is injured. Right? But the unpleasantness of this situation, like on a whole, like the burden I feel from my knee being injured, is amplified by my mind, by the state of mind that I'm in, right? And so we can work on this aspect, right? Like, if you tore your ACL playing basketball or something like that, meditation is not going to repair your ACL. You have to go get surgery to do that. But the burden, mental burden that comes with having a chronic pain or chronic injury like that, right? We can work on that with meditation. Does that make sense? Hopefully. Cool. I do find chronic pain can lead to anxiety, and I find it just weighs you down if I'm not yet. Dude, chronic pain and anxiety are like intimately related, which is kind of what we're going to look at today. And you'll see, Kavitha, you've been around for a little bit now. You'll see like, this is starting to sound a little familiar. Some of the things we talked about in our anxiety class, right? Because a lot of this burden that I'm talking about from chronic pain, it comes from our mind worrying about, will this ever go away? What if I can't do the things I like that kind of anxiety, right? Worried thoughts. So we'll get into that a little bit, but yeah, 100%. They're super closely related. Okay. So method 1 is what I will call healthy distraction. The key word is healthy. Right? Distraction in meditation is, we know how to be distracted, right? Not a good word, but a healthy distraction. Right. So we'll talk a little bit about what that means. Like, so when we think about our chronic pain, whether it's, a nagging injury, chronic relationships. Okay. Now we're really getting into it. Whatever our chronic pain that we're dealing with is, physical or mental, right? It commands our attention. It demands us to pay attention to it, right? Like, if we kind of let our mind do whatever it wants, it seems to just totally hone in on this chronic pain, right? So, for example, I told you that I hurt my knee skiing. Right. So then, my ski season got cut short. I was all bummed out. Right. But I'm like, okay, well, you know what? I'm going to make sure I get better, take care of it, and I'll be good for summer. I like hiking in the summer. Right. So the summer comes and I go out for a hike. I'm so excited, getting to go hiking. Like, where are we going to go? It's going to be awesome. The weather's beautiful. Right. And then I get there and I start walking a little bit and my knee hurts. Oh, and I'm like, what? Like, I, rested. Why is it still hurt? Is this going to hurt forever? Am I going to be able to hike? Like, I wanted to do some pretty crazy hikes this summer. Am I going to be able to do that? Like, what if I can't? That would not be cool. Right. And so like, now I'm on this hike and I'm like, my body is still hiking, right? I'm still like on this walk, but my mind is not hiking. My mind is totally only thinking about my knee. Right? My chronic pain. And so all of the awesome things that normally I love about hiking, it's like they kind of vanished, right? The birds chirping, beautiful, the sun, the warmth of the sun hitting you as you're walking, right? Being out in nature, the sound of the leaves blowing in the breeze, other people chatting, having a great time, right? It's as if those were not there. Like for me, they weren't there, right? Because all I could think about was my knee. Right. And then Kavitha was talking about like the anxiety of it, right? Like that's really what's happening is I'm in the future. My mind is in the future. Like, what if I can't do this? What if I can't do this? What if it's always like this? I'm totally not present in my hike. Right. Which stinks. because I love hiking, right? So the kind of important thing to note is that all those awesome things that are on the hike, they're still there. I'm just not noticing them, right? It's not like they're gone. It seems like they're gone, but they're there, right? So in the same way that if we are super plugged into and worrying about our knee hurting on a hike, we miss the awesome things about hiking, right? If we swap it, what if we swapped it, right? And we were so plugged in to the awesome things about hiking that we forgot about our knee, right? That ever happened to you? It does, right? Like it does happen, right? This is what I would call a healthy distraction if we do it intentionally. Sometimes it's like, oh, I got a project to do and I just watched Netflix instead, and like, I forgot about the project. Like, I don't know if that's what I would call a healthy distraction, unless this, the project is causing you a lot of anxiety or something. This is a good way of unwinding, right? But like intentionally choosing to focus on the sounds of nature as you're walking on this hike instead of your knee, and then bringing your attention back to the sounds of nature whenever your mind tries to think about your knee. That's a healthy distraction from your chronic pain. And what does that sound like, right? It's meditation. It's the same thing as breathing meditation, right? In breathing meditation, we focus on our breath. When we notice our mind is like trying to think about something else, we're like, nope. And we go back to focusing on our breath, right? And we start to relax a little bit. We can do the same thing with our chronic pain, right? We can choose to focus on something. I'm using the example of walking, but there's a lot of different examples. We can choose to focus on the sounds that we hear as we're taking this walk. And whenever we notice our mind is like, no, I want to think about how bad it is that your knee is hurt and how you won't be able to do any of the things that you love, we're like, no, I'm enjoying this walk and I'm going to focus on this walk. It's the same concept as breathing meditation. It is actually meditation. This is sometimes called walking meditation. Kavitha, absolutely. I find my world narrows so much and only focuses on my pain and nothing else. Yeah. Actually, world narrowing is a really great way to describe this, right? We want to, it's like chronic pain, nothing else exists. And we want to be like, no, a lot of awesome things exist. My knee might still hurt, but these awesome things exist and I should enjoy them, right? So sometimes when we get distracted healthily, our knee pain goes away, right? You know what's interesting to think about is sleeping. Sleeping is a good example, right? If you have a knee pain and then you go to sleep, once you fall asleep, your knee doesn't hurt anymore. You ever notice that, right? And it's not like you're asleep and suddenly your ACL tear is all better. No, it's still injured. But what happened? Your mind is completely focused on something else. It's dreaming, right? But it's completely focused on something else. Your mind is basically kind of meditating on something else. So much so that your knee pain is not there, right? Because your mind we can only really focus on one thing, right? Multitasking is not like I'm focusing on multiple things. No, you're focusing on one thing and then jumping around, but our mind can only focus on one thing. So if we really kind of let it plug into one thing, other things start to fade away a little bit. And that can happen with actual physical pain. Ed, you could also train your mind to go to that happy place when you hear a certain song or smell a certain scent. Absolutely. So, you know what? This is a really, ACL is like wow, I don't know what that stands for. It's like a tendon in your knee. And it's like not a great injury. It's very painful and problematic, but it's like a tendon in your knee. I'll just say knee injury. Ed, that's a wonderful insight and great segue for next week's class. We're going to really talk a lot about some activities you can do and turning those activities into a meditative experience, like things outside of just sitting down and doing breathing meditation. But absolutely, like kind of plugging into a sound or smell is exactly what we're gonna talk about next week. So, and these mindful activities, like I said, we're going to talk a lot about this next week. These are really good for chronic pain, because sometimes sitting down and being like, I'm going to focus on my breath. It's like the chronic pain is like, no, that's hilarious that you think that we are going to focus on your breath. I am focusing on the chronic pain. So sometimes we need to kind of like give our mind a bigger job, right? Than just being like, I'm going to focus on my breath. So something like walking is good, unless you like have really bad knee pain, and maybe that's not a good one. Listening to music can be a good one. There's a lot of different activities that we can do and turn into a meditative experience, but we'll talk some more about that next week. But good for chronic pain. So healthy distraction, right? That's one way you can try to help manage your chronic pain. And doing this also is training your mind to become familiar with being present, right? Which is a very important part of kind of finding happiness, right? Because if we're letting our mind wander, sometimes it's thinking about things in the past, it's thinking about worrying about things in the future, and we're like missing all the cool stuff that's happening around us, right? So this kind of method, like choosing to focus on something else and then bringing your attention back to it when your mind tries to go to the chronic pain, is meditation and is training you in mindfulness and is training you to be present. It's like 3 wonderful things in one. Great. Very efficient. Okay, so another important part of chronic pain that I think is worth mentioning is kind of cultivating some patience and acceptance. Now, Kavitha was talking about anxiety, and this might sound like we're kind of calling back to that because it's very similar, right? A lot of the power that chronic pain has over us is derived from us building up a mental familiarity that this thing equals like catastrophic to my life. Right? So, the first time our knee hurts, right? We're not like, oh no, it's all over, right? We're probably like, that's weird. My knee hurts. It wasn't hurting before, now it's hurting. Oh, it's probably better tomorrow, right? And then the next day we wake up and it's still hurting, right? And we're like, thought it'd be better by now, but it's not. And then, a week later, it's still hurting. And then, now we're starting to go down the rabbit hole of what does this mean? Did I tear something? What if I'm not able to ski? Can you tell them personal experience? Worrying about the future, really. Our anxiety. Our mind is being anxious about what this could mean, right? We're starting to make a connection between this thing, this pain, equals extremely, very, very bad, right? And our mind is becoming familiar with that. So much so that whenever we feel that pain, our mind's like, oh no, right? Now, what does that sound like, Kavitha, right? You mentioned anxiety. That's like anxiety, right? When we become so familiar with this kind of phobia or thing we're worried about being bad that whenever even we think about it, right? Boom, we're upset, we're anxious, right? So the same can happen with our knee, right? Hilda, hypochondriac. Yeah, I mean, like some people are, but like we all get worried about ourselves. That's totally normal. I'm worried about a lot of things, So it's not abnormal to worry about these things, but it is important to know that it's happening and to know really that your mind is like kind of contributing to the pain that you're feeling, not maybe on a physiological like perspective, but like an overall like mental burden, like the weight of a chronic injury. Your mind is playing a huge role in this, right? So just like we identified the steps for anxiety, you can start to do a mindfulness exercise where you're paying attention to what your mind is doing when it's kind of focusing on your chronic pain, right? So similar to our anxiety class, we come into contact with something. In this case, our pain, we feel the pain, right? Then what happens? The negative link, we're like, oh, this is bad. Oh, no, I don't like this. And then we start to exaggerate how bad it is. I'm never going to be able to ski again. I'm not going to be able to do the hikes that I want. I'm not going to be able to enjoy my life, right? You start to exaggerate this. And then the next step is we start to like wish away. We start to be like, I just wish this would go away. We feel helpless, like we can't control it, right? It's the same steps that our mind's going through with anxiety, because a very large part of chronic pain is the mental anxiety that comes from chronic pain, right? I actually have a friend who had cancer, and I work with them meditating every now and then. And he said something to me that was like, whoa. He said that he beat the cancer, like awesome, right? And he said that the anxiety about it coming back is worse than when he was actively being treated for it, right? The anxiety of it was way worse, like just worrying, will this come back? Will I have to do this again? Right? That was like way worse than that. That's how powerful our mind can be with chronic conditions, with like, a serious ailment, like, something like cancer or something like that. Pain also taught me to realize that life isn't perfect, but I can still be happy in that imperfection. Kavita, that's beautiful. And that's exactly what we're trying to kind of do with chronic pain and meditation. We're trying to work on our happiness aspect so that we're able to enjoy life, even if our knee hurts, right? Even if our shoulder hurts, even if we're itching, even if, we're a little anxious once in a while. That's kind of like what we're trying to do with meditation, right? So it fits in really nicely. One thing we can do to help with this kind of patience and acceptance, right, is instead of when we feel our knee hurting, being like, oh no, my knee hurts, right? We can say something like, my knee is acting up and that's okay, right? A little different response. We could even take it a step further and be like, my mind is experiencing some anxiety about my knee hurting, and that's okay, right? Sometimes my mind's going to be anxious, right? So basically what we're doing is we're trying to sever this like link that we've made that this equals catastrophic. We're trying to kind of basically force our mind to think of it in a little bit of a lighter way, right? It might seem ridiculous to like say that out loud or to yourself. You don't have to say it out loud. You can say it in your mind. But it really does help a lot, right? And another method we can use, which is actually it's actually like a lesson that's normally taught in meditation on death. It's very dark. It's like, okay, what's he talking about now? But when you meditate on death, like one really kind of empowering thing is to like kind of recognize that like, hey, we don't know what's going to happen. Today could be it, man. So I better like really enjoy this day. Right. So that's kind of like one aspect of thinking about death in like a more positive way. But we can kind of do something similar with our knee. So like every time we wake up, what if we were like, you know what? My knee may hurt today. Right? Take the like uncertainty out of it, right? Take the like, oh, why is my knee hurting now? Like it might hurt today. Like be okay with that, right? My knee might hurt today, but you know what? I still can do a lot of awesome stuff, and then go about your life, right? So even kind of like waking up with that, like kind of affirmation is really powerful in terms of helping with acceptance and helping with like internal patience with chronic pain. Cool. Sorry, won't talk about death anymore. And then the third kind of thing I wanted to talk about just briefly is a technique that you may have heard before, but is really good for chronic pain, right? And this is a technique in changing perspective. So the example I generally use for this is like, if you think about, how you give great advice to your friends all the time, they're like, oh, I got this problem. You're like, oh yeah, do this, this, and this, some good advice there. But like, you never can give yourself good advice, right? You ever notice that, right? Give better advice than you receive or give to yourself, right? So this is because when the problem, right, the kind of rain cloud is over somebody else's head or kind of off in the distance, right? There's more space between us and the problem. We can view the problem with more clarity, right? So when the cloud is over our head, right, we're kind of panicking, right? We're not really thinking as reasonably, right? We react very differently to things that are happening to us than when they're happening to other people. And this is a really like deep topic in meditation, and it comes up a lot, how the perspective of us versus others, right? And how we treat it differently, right? And part of chronic pain's power, the burden that we feel from chronic pain, is because it's our chronic pain, right? And so we start to sometimes get lost in that rabbit hole and start to really kind of dive down into getting like depressed about it and anxious about it, because the rain cloud is over our heads. So one really great kind of mind activity, right, that we can do is to imagine, like bring to mind the chronic pain that you're having, right? And imagine that your best friend in the world is having this pain, right? Like really try to like imagine that, right? And they're saying to you like, oh, they're doing what you're doing. I'm never going to be able to hike again. What if this is like this my whole life? And what do you say? You're not going to be like, yeah, probably can't do anything, right? No, you're not going to say that. You're going to like have compassion. You're going to be like, hey, it's okay. Like some days it's going to be better than others. You're still going to be able to do a lot of fun stuff. Hey, let's go do this. Like it's a totally different response for when it's happening to your best friend. So this activity is all about kind of putting your mind in that scenario where your best friend is having your chronic pain, right? The thing that you're so upset about, and then seeing what advice would you give them? How would you respond to that situation? And can you take some of that advice, some of that response, that skillful response, and use it for yourself, right? Because why would you tell your best friend something worse than yourself? You wouldn't. So you might as well take the better advice, which is you giving them advice. Kavitha, I always am much more positive about other people and their illnesses, but when it comes to me, I'm very negative and feel like I'll never get better. Yeah, it's totally natural. And this is, like I said, this is a massive topic in meditation, right? This concept of self and other, and how we have very different treatments of these things, right? So Hilda, you like this idea? This is a great way if you're like really struggling with focusing on a breathing meditation, focusing on a healthy distraction, right? Maybe the patience and the acceptance angle is like, not really kind of jiving with you. This is a really practical way to try to teach yourself that you can respond in a different way. You can respond with more compassion for yourself than you probably have been, right? So I recommend this for a lot of things. It's really good for chronic pain, 100%. Cool. So these are 3 things that I would try to like focus on if you're experiencing some chronic pain. And again, it's not just physical chronic pain, right? It can be mental, right? Anxiety, depression. These are chronic pains, an unpleasant feeling that is persistent, right? So there was a request for a mountain meditation, which actually is really good for the patience and acceptance kind of aspect of chronic pain. Basically, this meditation is all about teaching you to realize that you, even though you're experiencing some unpleasantries, maybe externally, like your knee hurting or whatnot, like internally at your core, you are still very calm, very peaceful. You're like an immovable, like kind person, and you can be that even when your external conditions aren't the best, which is really good for chronic pain because the external condition is not very pleasant. Tashita, could you summarize the 3 things? Yes. Great idea. So method 1 is what I would call a healthy distraction. So that is choosing to focus your attention on something other than your chronic pain, right? And then when you notice your mind is going to your chronic pain, being like, nope, bring it back to focusing on the thing that you chose. Healthy distraction, right? And sometimes the kind of pain, the burden of your chronic pain starts to fade a little bit. The second was patient and acceptance, right? So basically, we're trying to be okay with the fact that our pain is happening in this moment, right? We're trying to affirm that yes, this pain is occurring, but that's okay. It's not catastrophic. I can still enjoy my life, right? And so we talked about the kind of like the like waking up and saying, you know what, my knee may hurt today. You know, just get that out of the way. My knee may hurt today, but I'm gonna go out and do my best on my walk. You know, and if I have to turn back early, so what? You know what? I got outside, did a great walk. So like kind of ushering in a level of patience and acceptance for your chronic pain on a daily basis. And then method 3 is this idea of changing perspective. So imagining your best friend having this chronic pain issue, and what would you tell them? What advice would you give them? How would you respond to them being really upset about it? What would you say? And then can you kind of take some of that advice for yourself, right? So those are the 3 things. That's a pretty good summary. I probably could have just did that. Okay, so we're going to do mountain meditation. It's fun. It's wonderful. Everybody likes it. So just sit, relaxed, comfortable. If you were realizing now your last seat was uncomfortable, now's a good time to change. So you can go to the couch, or I don't know, whatever is more comfortable if you're having trouble before. And we're going to start this pretty much the same way that we did last time. We're going to do a little bit of a breathing meditation, and then I'm going to lead us through a visualization to help us with some kind of resiliency and patience and acceptance for our chronic pain. Okay? All right, so go ahead and close your eyes and relax and just follow along with what I'm saying. So let's once again just check in with ourselves. How are you feeling now? Different than before? The same? Whatever it is, doesn't matter. We're just noticing. We're practicing mindfulness. We're practicing noticing what our mind is doing moment to moment. And having checked in, you can once again turn your attention to your breath in and out of your nose, very gently, very naturally. See if you can follow your breath for the entire inhale, and then see if you can follow your breath for the entire exhale. Can you stay with your entire breathing pattern? Breathing in and out, very gently, very naturally. And if you notice that your mind is drifting, maybe it's trying to think about a chronic pain that you have, be it physical or mental. Whenever you notice your mind drifting, just gently guide it back. Guide your attention back to your breath. Make a choice. Choose to focus on your breath. In and out. Very gently, very naturally. And as you start to plug into your breath, as you start to focus on your breathing patterns single-pointedly, you may begin to notice some things about your breath that you missed before, you didn't notice. Maybe you're now paying attention to the temperature of the air as it enters your nose and exits your nose. The air feels a little cooler as it is inhaled, and a little warmer as it's exhaled. Or how your shoulders move with your breath, rising, falling, your chest expanding, contracting, your entire body an active participant in breathing. Your entire being breathing in and out. You're beginning to enjoy breathing itself. What a wonderful thing to be able to do. To be able to find happiness, peacefulness in something as simple as breathing in and out very gently and very naturally. So after relaxing our mind in this way, clearing some of the busyness out of our mind, we can then choose to use this more relaxed mind to investigate something, to think critically about something, to learn, to become familiar with something that's important to us. Today, we're going to do a meditation that focuses on having us become familiar with the fact that our mind and our very being are naturally very peaceful, and that peace is always there for us, even when our external conditions are less than ideal. So just follow along with what I'm saying. I'd like you to bring to mind the most beautiful, majestic mountain you have ever seen. Just imagine it. Bring to mind what your mountain looks like. Is it small, large, rocky? And I'd like you to imagine that on your mountain, it is summertime. The sun's warmth hitting the mountainside. All of the vegetation is lush green. The rivers flowing healthily, teeming with life. The whole mountain teeming with life. All the animals enjoying the mountain. Just imagine it. Summer will soon turn to fall. And with fall comes a little bit cooler weather. The vegetation starts to brown. Some of the animals are getting ready to hibernate. The water is maybe too cold to enjoy. The external conditions on the mountain have changed. But at its core, the mountain remains the exact same as it was in summer. Unchanged, immovable. Fall will turn to winter, and with winter comes very harsh conditions in the mountains. Lots of snow, cold, blizzards. All of the vegetation has died. The rivers have frozen. The animals are hibernating. The external conditions of the mountain are a lot more challenging. But at its core, the mountain remains unchanged. The same as it was in fall, the same as it was in summer. Immovable. Winter turns to spring, the snow thaws, greenery comes back to the mountainside, the animals come out of hibernation, the rivers are starting to flow again. But in spring, we often see thunderstorms, and maybe one evening, there's a bad thunderstorm, and a bolt of lightning strikes the side of the mountain. scarring it. The external conditions of the mountain have changed. The mountain is bearing the scars of the changing weather. But at its core, the mountain remains exactly as it was in winter, exactly as it was in fall, exactly as it was in summer. The mountain is immovable. We need to learn to view ourselves like a mountain. Even though we will undoubtedly experience varying external conditions, chronic pains, illness, feelings of sadness, we can know that at our core, we are peaceful and kind, reasonable, considerate, compassionate, loving human beings. That is who we are. And our external conditions, they may change, but it does not change us. And we can still be that happy, caring, joyous person, even when the external conditions are more challenging. We can be like a mountain. So just sit with that for a little while. Imagine yourself as a mountain. Identify with being a mountain. Okay, when you're ready, you can open your eyes. That was a mountain meditation. If you're new, I feel like the message is pretty clear, right? It's a cool visualization, and I think it works really well for chronic pain. So I'm glad that you guys brought it up because I wasn't planning on doing it. But I think it really works well for allowing us to feel empowered that we can still be our happy, positive, loving self, even when our chronic pain is kind of nagging at us, like clamoring for our attention, right? So I usually actually use this mountain meditation for anxiety. So like, it's actually a really great crossover, because it's basically the same thing, right? It's helping us be okay with the fact that our external conditions may be challenging. We can still work on recognizing that inside we are still wonderfully happy and peaceful and can enjoy our life. Carol, lovely. Keith, Kavitha, thank you. That was great. Awesome. Great as always. Did better this time. That's great. So Dorothy, yeah, every time it's going to get a little easier because your mind is like, oh, the mountain meditation. Here we go. Which one did I have planned? I was going to do one about the third method, like changing perspective, which we've done before, but it'll come up again. But there's this is kind of the beauty of meditation is there's like, you can be kind of creative with how you want to like attack your problems, you know? But I think this was great. Okay. So if you did have a good time today, awesome. I'm glad to hear it. Come on back next week. We do a new topic each week. I usually don't know what I'm doing, but next week I do know what I'm doing. We're going to look at some ways you can transform daily activities into like a meditative practice, to get you a little bit more meditation practice than just traditionally kind of sitting down. Tashita, I'm glad you had a good experience. So if you did enjoy yourself, you can subscribe to my YouTube channel. That would be awesome for me. It tells YouTube like, hey, people are interested. I'm getting close to 1,000 subscribers, which is like the benchmark for like legitimacy in YouTube. And you also get notified when I'm going live, right? So if you like if you're like, oh no, I didn't remember it was Wednesday, you'll be like, hey, it's Wednesday. Time to meditate. That's cool. And I also do one-on-one classes. So if you were like, this is awesome, I'd like to really dive into a specific problem I'm having, just email me and we'll figure out a good time for us to meet and do like a one-on-one meditation. Hold on. Let me write it in the chat. I have to do maximum concentration so I spell everything correctly. You may become famous soon. I don't know about that. I'm enjoying hanging out with you guys on Wednesday. That's cool. Gail, thank you so much. So Healing Experience, thank you, Gail. I appreciate all of you guys for being here. I know life is very busy, and this is, a large amount of time to commit to something. But kudos to you for being here, trying something new, and hopefully you found it to be helpful. Thank you. It was amazing. I feel better, more relaxed. Great. I'm so glad to hear that. Everybody had a wonderful week. It's my pleasure to do this each week with you guys. So thank you so much for giving me that opportunity. And I hope to see you next week when we're going to talk about some fun activities we can make into like a mindfulness practice, right? We're going to do the drinking water meditation again, because that was a big hit. I had a lot of people send in that they love that. So I feel like that's a good one. We'll do that one again. All right. Take care. Everyone have a great week. Be a mountain.